Minister of Health and Wellness, Dr. Christopher Tufton, briefed the nation on a range of COVID-19 issues on Tuesday.
In the last week, the country added some 2,818 new COVID-19 cases and saw hospitalizations move from 245 to 270 patients positive for COVID-19. And I just pause to say here, there's a direct relationship, and this is borne out by an assessment of the data, a direct relationship between the number of cases that are reported as positive cases and the number of hospitalizations, or the increase in hospitalization. One almost naturally follows the other. The present state of hospitalization has become for us alarmingly high, and it is something we have spoken about in the past, that if we get to a stage where we become overwhelmed, and that's when we see the real consequences of the COVID pandemic. We have currently some 13 of 22 hospitals across the island at the red alert phase, which means that they have a greater than 84% occupancy level for its isolation capacity. 9 of these hospitals are at 100% or greater capacity. The current hospital census shows that Cornwall Regional Hospital, Falmouth Hospital, Annotto Bay, Port Maria, Mandeville Regional, Maypen, Kingston Public, Princess Margaret, and Spanish Town hospitals all exceed their capacity to house patients who require isolated care. And this, of course, has to be worrying, not just for public health, but for the entire country.
Those who are ill are required to stay approximately 14 days in hospital. In a bid to respond to the need for hospital beds, the ministry is increasing the bed count in public hospitals with the use of field hospitals.
In addition to those, totaling some 72 beds, we're adding an additional 20 beds at the National Chest Hospital. And I visited the National Chest Hospital yesterday. Their COVID ward was 100% taken up, 36 beds. They are now adding additional 20 beds, and we're providing for them some additional infrastructure to support that. As well as at the University Hospital of the West Indies, where I again visited yesterday, they are converting an existing ward for general usage, which contains some 25 beds, to being an additional COVID ward. So UWI, which was again at capacity with 41 beds, are adding an additional 25 beds in order to accommodate the increases in the numbers, or the expected increases in numbers.
Jamaica is currently experiencing a nursing shortage due to increased overseas recruiting of nurses.
Each regional health authority has been instructed to hire additional staff based on their needs assessment.
Dr. Tufton stressed the need for COVID-19 measures to become a matter of personal responsibility.
I want to again underscore the importance of members of the public adhering to the COVID-19 protocols that have been put in place to reduce the spread of this virus. Citizens, I repeat, must play their part. We have to take a whole of society approach. The truth is, without compliance with the DRMA regulations, we risk undermining the efforts of the government, and indeed the government of the efforts of the people who comply, because one action affects all of us.